Hello, my name is Fariha Abbasi-Feinberg. I am the medical director of sleep medicine at Millennium Physician Group, and I'm on the board of directors for the American Academy of Sleep Medicine. So I got involved with sleep medicine. I developed a love for it in medical school because my neurology professor talked about it for 2 hours. So I probably got more education than a lot of people. And I went into neurology residency knowing that I was probably going to do epilepsy and sleep. So that was my path all along. It didn't quite work out that easily though because of family requirements. I ended up doing some general neurology for a few years and then really got involved in sleep in 1999. I made a move to a different place, different town, and I had the opportunity to do some neurology and really focus on a sleep practice and grow the sleep practice. And at that time, I decided to go ahead and work with a board-certified sleep physician and go through the pathway and get boarded in sleep medicine. And now I do 100% sleep medicine. I've been doing that since 2005. I've got involved with the American Academy of Sleep Medicine through Dr. Susie Esther, who was my colleague at the time, and she was the president of the American Academy of Sleep Medicine coming up, and she asked me if I would be willing to be on a committee. And initially I said absolutely not. I had no capabilities, I thought, and no interest really, and I was really busy just running my life, family, and practice. But she dragged me in, and I've loved it ever since. Before I got involved with the Academy, I really didn't know a whole lot about it. It was basically the accreditation body. I knew that. I also knew that there were courses that were being taught by the Academy, but I really didn't have an understanding of the structure and the breadth of what the Academy does. Yeah, my understanding of the Academy has really grown over the years. I think I'm always impressed by how much we do as an Academy, how patient-centric we are, how member-focused we are, because we are really trying to set standards and guidance for taking care of patients with all types of sleep disorders. We're also helping members focus on business aspects. We're involved with the new technologies that are coming out. There's a lot of advocacy that goes on. So the Academy's influence is really quite wide. I always tell people that being part of the Academy has balanced my life. I mean, I love taking care of patients. I'm very involved with the clinical aspect of my day-to-day practice, obviously. But there's something about doing or being involved with the Academy that is so much bigger than me, my patients, and my practice, that it gives me a bigger why. It gives me a sense of satisfaction. And there's been a lot of personal growth for me being a member of the board of directors. I like looking at what's happening in healthcare from a higher level, looking at healthcare policy, looking at reimbursement issues, looking at practice standards. I think all of those are factors that I don't pay attention to day to day. It's really easy to get overly involved with just what's happening in your own little business and in your own little bubble. And sometimes taking a look at what's happening around the rest of the country, I think, is very helpful and eye-opening. Yeah, some of the major issues that have been involved with sleep obviously are the changing and emerging technologies that are coming out, not just for diagnostic purposes, but also for therapeutic interventions that are available. Just walking around today on the floor, there's all these new options for treatments. There's new medications that have come out. And I think we really need to help guide our members as to what is valid, what is, just bells and whistles, and just trying to figure that out. And so I feel like the Academy needs to really help our membership understand what's real and what's something that's just passing through. I see that the American Academy of Sleep Medicine is growing. I look at it like we're maturing. It's sort of like when we grow as an individual, right? You first have to become independent. And then once you're strongly independent, you can become interdependent. I feel like the academy is there now and over the last few years, and it's going to continue to occur that way, where we grew as a field and we're independent, and now we're becoming more interdependent. We're working synergistically with our sister societies, with payers. We're hoping to work with patient advocacy groups and even industry. I think I really like that African proverb that says, if you want to go fast, go alone, but if you want to go far, go together. And I feel like the academy is at that change now where we're working together to do what's really best for our membership and our patients. I think of interdependency as 1 + 1 doesn't just equal 2, but it can equal 3. So you take the strengths of different organizations and you work together to try to achieve goals that are aligned. I see that while we're working with the development of the new home sleep testing codes. We could try to go at it alone, but we wouldn't go very far. If we go at it with our sister societies and have industry support, I think we're going to go much further with it. There are so many academy leaders that I have looked up to for so many years. The ones that I've been intimately involved with, obviously, I've seen their leadership style. Kelly Carden was the first president of the academy when I came on board. But just prior to that, Doug Kirsch was the president, so he stayed on as past president. And watching how much they knew, how caring they were, their leadership styles was really fantastic. Since that time, I've had the fortune to work with a couple of really incredible presidents as well, and each of them has had their strengths. And every year, I feel like we get better as a board, and I learned something from the president. I think the strengths that make somebody a really great academy president are being able to listen and get input from lots of different individuals with different viewpoints. I also feel that the academy president has to be able to interact with different constituencies that are involved in sleep. They are the public face of the academy. And so I think that's really important. I think working with patient advocacy groups has been one of the great accomplishments of the academy since I've been involved with the academy. There's also been, again, working together with other organizations. I really see that as a positive thing. It really has strengthened us, I think, and I see that as a major positive. Some of the more specifics that I think are really important is we're reevaluating how we do certain things that we've always done a certain way, right? And we're trying to evolve and make things more efficient. So for instance, we're looking at clinical practice guidelines, and instead of coming up with a new one every 10 years, maybe coming up with a focused update that doesn't take as long, so that we can guide our members in something that's a little bit more meaningful and timely. So I think that's been a huge change. I also feel like the board of directors has really changed its purpose over the last few years. It's become much more strategic instead of being as operational as I think it once was before my time. But we try to think of things at a very high level, and then we let the academy staff handle the day-to-day operations of how to accomplish those goals. We also just recently did a strategic replanning, I guess, and updated the strategic plan. So that's been a huge accomplishment. And it was a very thoughtful process that we went through to figure out where we need to focus our efforts over the next 3 years. One of the things that I always think about is there's so much that we could do, but what should we do that's going to have the greatest impact? And the strategic plan is helping us to focus on how to spend our time, our treasure, and our talent to accomplish those goals. Right, so the new strategic plan was just released, I guess just yesterday was the first time that most people saw it. But we're going to focus in on sleep medicine awareness So in the past, I think we were trying to raise the awareness of sleep in general. And I think that was a great thing to do 5 years ago with our old strategic plan. At this point, we're focusing more on sleep medicine and taking care of patients, but also taking care of our patients. So we're going to be trying to raise awareness with primary care, with other specialties that we can have some overlap, but also really work on insurance payers and things like that. Goal number 2 is going to be on practice sustainability. You know, we hear constantly from our constituencies and members that there are issues with reimbursement and prices going up, and a lot of practices have had to deal with all the issues during COVID. There are practices that are closing their doors because of this. We know that that's not a great thing for the field of sleep medicine or our patients. And so we're looking at different models of practices that can continue to create sustainable practices. And then the last is technology integration. You know, again, there's so much new technology in terms of what's happening, not just what's available now, but what's going to happen. How are our members going to use this technology to make their life more efficient and perhaps, increase their ability to take care of patients? So those are really the 3 major focuses of this new strategic plan. I'm hoping that we are on such a good trajectory that we're going to continue to grow. We're going to continue to attract amazing physicians, clinicians, researchers that continue to do amazing work and take care of patients. We're hopefully going to continue to spread the word about the importance of sleep medicine and continue to provide guidance and standards of care for the care of patients with sleep disorders. I think some of the major challenges are our dwindling workforce. There's many of us that are over the next few years thinking about possibly retiring or changing what we do. And there's not enough new sleep physicians coming into the pipeline. So that is an issue that's going to affect us. I think with the new A-STEP program for APPs, we're trying to fill some of that void with other providers that can help take care of our patients. I think that's a major challenge. Reimbursement and the business of sleep medicine continues to be a challenge for our practices that are out there. We need to help people thrive and not just survive. And I think that's going to be an issue. And then I think some of the other problems are general health, what's going on in healthcare industry. There's a huge number of folks that are going through burnout that affects us as well as the rest of physicians out there. I think our numbers are a little bit better than the national average in terms of burnout rates, but that is a problem as well. Yeah, I'm not sure what my practice is going to look like in 5 years because, again, I'm of that age where at some point in the next few years, I may think about making some adjustments. I've always said that as long as I'm having fun taking care of patients, I'm going to continue to do so. And so hopefully I'll continue to do so in 5 years from now. I think the Academy in 5 years is going to be in a strong place. I look at some of the newer board members that have come on. They are enthusiastic and bright and business-minded and very caring individuals. And I think we've got great leadership from Steve Van Hout, and the staff is just incredible. I think one of the great things I've seen recently is that more and more staff members have gotten their MBAs, and there's a few more that are in the process of getting their MBAs. And so, I think the Academy staff is really rocking it. I think the big questions to answer still in terms of what's going to happen to sleep medicine is, are we ever going to move away from sleep testing as the major part of our practice? And there's been a lot of debate about that. It's like, do you even really need to do a sleep study to diagnose certain sleep disorders? I mean, clearly for some things you do. But there's been folks that have said all along, why don't we treat somebody and see what happens? And so I don't know what's going to happen with that. I think when I talk to my patients about that scenario, they say there's no way that they would want to be committed to using a treatment without knowing if they needed the treatment, right? And so I think there's a lot of hesitancy on patients' part. And so I feel like we have to stay very patient-centric and try to really practice in a individual manner and not make general suggestions. But there might be some people that say, you know what, I'm tired, I snore, put me on a CPAP, let's see what happens. And so I don't know how that's going to change the practice. I don't want to sound like I've drunk the Kool-Aid, but I have to say that I really love being part of the Academy. It has taken me from a place of close to burnout and given me a new purpose. And it's really been very, very helpful to me as an individual. So I always will have great respect and love for the AASM. The AASM is an incredible organization made up of caring individuals who want to do the best thing to take care of patients and their members.